Okay, Maria, I want to circle back to something you said earlier about people not trusting the healthcare system. And
Mhm.
you were actually featured in an article in Counseling Today from last May, and you talked about some Black families not being completely honest with healthcare professionals when talking about their children because they fear that their children will be taken away.
Mhm.
Could you elaborate on what you meant by that?
I surely can. We know that, there's a long history of experimentation when it comes to Black community and medical community. So that leads to a level of mistrust. Also, the term social worker, hearing social worker and having them come in your home leads you to have some defenses because historically, Black people think of social workers as somebody coming in to take my child away from me. They working with CPS. They're working with the people who are going to take my children away from me. So if I'm completely honest with them, how are they going to use that information to then take my children away? So sometimes there's a guard up and not wanting to be completely honest because we're not sure of how they will use that information. Even for me, even though I am under the umbrella of clinician, which also includes social workers, marriage and family therapists, and then mental health counselors. They may equate me with, oh, social worker. So what are you going to do and take my child away? So it does come with educating the parent and understanding that not all social workers are coming in to take your child, but it is difficult because even the healthcare professionals have come in my home. I've had the same defenses of, oh my goodness, how are you going to weaponize this information that I'm giving you? Because it's very well has happened to where the information has been weaponized against us.
Mm, hmm. Right. And so these parents, maybe they know what autism is, they have the awareness, but still they choose not to seek out the help.
Hmm. Hmm. For fear, and it's a real fear, especially for Black parents, because we do know that within working with CPS, there's a higher chance of our children being taken out of the home rather than having rehabilitation as far as doing what is necessary to keep our children in the home. So it is a fear that is valid.
Hmm. Hmm. So it's leading to maybe kids not getting diagnosed early enough or ever.
Um, Probably on the medical side of it, but we know that within the school system, if the school sees, you know, um, any deficits or gaps or developmental delays, that they will, reach out to start the process within the school system. So on the medical side, yes, most definitely.
And can you talk a little bit about what that looks like at school and how sometimes there could be a misdiagnosis of autism for like oppositional disorder? Is it oppositional defi?
Yes, ODD, oppositional defiant disorder. So within the school has 13 categories. They don't diagnose, they do categories that they'll put your child in to receive special education services. And because of evaluator bias, because of the biases within the actual evaluations, um, people not having culturally responsive training, it is a higher chance of a Black child being placed in a behavior category. More likely, that EBD category that will lead you to a self contained classroom that is just inappropriate on all levels. So there's a high rate of misdiagnosis when it comes to Black children, and they're more often diagnosed with any kind of behavioral um, disorder rather than autism. So your oppositional defiant, your ADHD, any of those rather than autism.
Hmm. Yeah. And so sometimes you'll see kids like a black kid and a white kid who are showing the same behavior, but then they're
Hmm.
actually being treated and viewed differently from the teacher and from the school system.
Very differently. And the APA actually did a study with incoming teachers on on this exact thing. And they had, students that they would look at just the emotions on their faces. So there was no talking to be done. It was just, I'm looking at your emotion and I'm going to say what emotion you're displaying. And by and far, Black students, especially Black boys, were seen as showing the feeling of mad. That they're just mad, even though that was not the emotion that they were displaying. So teacher bias is extremely real. Just off the basis of race alone, I could be looking at this white child doing something, and I see it as, oh, okay, we just need to give them a little more resources. And I could be looking at this Black child doing something, and it's seen as deviant, as aggressive, and puts them right on the trajectory for school to prison pipeline.
Mm-hmm. Right, when we could be giving them the resources that they need to actually
Exactly.
succeed.
Exactly.
You've been watching Autism Knows No Borders. If you like this video, please give it a thumbs up and subscribe to our channel. Also, we'd love to hear from you, so let us know what you think in the comments section. Click here to watch this interview in its entirety. You can also find us on your favorite podcast app. Tune in each week for engaging conversations of how people across the globe are inspiring change and building community. Thanks for watching. Take care.